just to give you some flavour of the kind of vaccines that potentially may come through over the next year or so. There are the messenger RNA vaccines. That was the subject of the Pfizer announcement on Monday. These vaccines essentially send a coded message to the immune system to tell it to make COVID antibodies. There are the adenoviral vector vaccines. These insert the COVID spike protein. That's the key antigen, the key protein which allows humans to recognize the virus and allows the virus to bind with the human cell. Those are inserted into a harmless or weakened common cold virus, and that again stimulates antibody production. Then there are the protein adjuvanted vaccines. These are slightly older technology, and they are effectively pieces of the COVID virus protein broken up, and when given with an adjuvant, they stimulate antibody production. And then finally, there is the option of a whole virus approach, which is where you take the virus and you kill it, and then it is safely injectable and it stimulates antibody production. So there are many different approaches, many different manufacturers, and we're just at the beginning of this journey. And it is that complexity of what we hope we'll have soon versus what we hope we'll have within 9 to 12 months that makes the job of the Joint Committee on Vaccination and Immunisation very challenging indeed, but a terribly important job in terms of then determining, after authorisation, who should receive the vaccine. And Professor Lim is here to explain to you some more about that.
Thank you very much. As Jonathan says, the Joint Committee on Vaccination and Immunisation, JCVI, is an independent expert committee, and we're constituted to advise the Secretary of State on the provision of vaccination and immunisation. During this pandemic, we've been meeting weekly recently to appraise ourselves of all the available scientific information that is relevant and to be able to make the best possible recommendation in the most timely manner. This is all on an independent basis. I just want to describe the current interim recommendation from JCVI regarding the priority groups for vaccination when a COVID vaccine becomes available. The current phase that we would suggest or recommend is a phase where we prioritize the most vulnerable individuals in society, specifically people who are most likely to die from severe COVID-19 infection. And we take into account the important role of the NHS and social care as well. A further consideration in our prioritization is that the program needs to be recognizable, it needs to be understandable to everybody, and importantly, it needs to be deliverable. We've reviewed data on how the pandemic is progressing in the UK, the risk factors that are associated with severe disease from COVID-19, and mathematical models that have looked at different vaccination strategies and how those might work. I'll just come on to the priority groups as they are defined at the moment, and I just want to underline that these are interim current recommendations and they may change as we get more information. At the very top of our priority list are care home residents and people who work in care homes. This reflects the devastating impact of COVID-19 in our care homes, as we all know. Following on from care home residents, we will prioritize older individuals, going down age bands, down from 80-plus-year-olds to 60-plus-year-olds. And the reason for this is because age is by far the strongest risk factor associated with severe COVID-19 disease. Following on from those who are age 65 and above, we will then prioritize individuals, particularly adults, I should say, who have an underlying health condition that puts them at risk of COVID-19 disease. Following on from there, we will keep going down the age bands to individuals who are 50 years and above. That describes phase one of the program, And phase 1, as I say, is aimed at protecting the most vulnerable. If phase 1 is completed, then we will have protected, hopefully, over 99% of those individuals who are at risk of dying from COVID-19. We have not decided yet on who else should be vaccinated beyond phase 1. That's not to say that they shouldn't be vaccinated, but simply that we haven't decided yet on prioritization. And that's because we need more information, hopefully, on the vaccines, who they are good for, and whether they protect against transmission or infection.